Good afternoon, everyone. Welcome to another exciting segment of Pregnancy and Me webinar series. This program simply gives us the best speakers from all over the world, especially brought to us by Fly Free for Health, Pregnancy and Me, 4 East Drug, and KK Women's and Children's Hospital in Singapore. I am Kylie, your medical buller and moderator for today. For those of you who have attended this webinar for the first time, please note that you may type in your questions in the chat box located at the bottom part of your webinar control panel. Questions will then be answered by our speaker at the end of the presentation. Moving on to our topic for today, a significant number of women's painful statement is, "Doc, I can't hang on to my pregnancy." And so this afternoon, that problem is going to be addressed by our distinguished speaker. Our speaker for today is Dr. Kenneth Leong. He is a practicing obstetrician and gynecologist with special interest in infertility, IVF, endometriosis, tubal diseases, and advanced laparoscopic gynecological surgery. As part of his laparoscopic surgical repertoire, Dr. Leong performs laparoscopic endometriosis surgery, fibroid surgery, total hysterectomy, and tubal reversal surgery using the conventional straight stick laparoscopic instrument, and increasingly the Da Vinci robot for his advanced and complicated gynecology surgery. He is also an IVF clinician with Monash IVF and a visiting medical officer for Mercy Hospital for Women in Heidelberg and Box Hill Hospital. He has private admitting rights to Epworth Hospital Group and Mitcham Private Hospital. So, without much ado, let's welcome our speaker for today, Dr. Kenneth Leong. Dr. Leong, over to you now.
Thank you, Kylie. Thank you for your very kind introduction. My talk this evening, in fact, is on this topic called recurrent miscarriage, with a provocative title of "I Can't Hang On to My Pregnancy." Now, next slide, please, Kylie. Let me just...
Okay. Okay.
Okay, so firstly, I would like to say that recurrent miscarriage is actually a recognized disease entity. You are not alone in suffering from this condition, and there is definitely help out there if you have this problem. Okay, now, what is recurrent miscarriage? These are the four things that I will be touching on this evening. Firstly, the definition of recurrent miscarriage, some interesting statistics about miscarriage in general. We'll touch on some of the causes, and what can you and your doctor do about it. So the most widely accepted definition of recurrent miscarriage is 3 or more proven consecutive miscarriages. Now, it can be defined variously. Some people would define that based on their age. If you've had more than 2 and you are 38 years old and older, that would fulfill the definition. But by and large, most people would accept 3 or more proven consecutive miscarriages. And what is a miscarriage? Well, it is failure of pregnancy to reach viability, which is generally attained at 24 weeks. Now, the true definition of recurrent miscarriage affects approximately 1% of all couples trying to conceive. But miscarriage itself is the most common complication of pregnancy. Okay, now, miscarriage affects probably 1/5 of all clinical pregnancies, and by that I mean pregnancies that are known. So a woman knows that she's pregnant and then unfortunately miscarry. However, if you consider all pregnancies, whether they are known or unknown, and you might think, how would one not know that they're pregnant? Well, surprisingly, quite a few out there, they might not suspect it, other than the fact that they have a late period. So if you include all known and unknown pregnancies, probably up to 50% miscarriage. So it's extremely high figure. Let's talk about some of the risk factors of recurrent miscarriage. The most important risk factor for recurrent miscarriage, or actually for miscarriage as a whole, is increasing age, what we call maternal age. So at 25 years old or less, you've got a 9% risk of miscarriage when you're pregnant, and this increases to, more than 75% when you are 45 years and older. This is a graph showing the prevalence of miscarriage per age bracket, and again you can see the increasing prevalence here at the age of 38 and 40. It's 28% there, and when you're younger it's less common. Now these figures are from different data sets, so they don't always overlap. They don't always have the same figure, but you get the the general gist of it. Previous history of miscarriage is important. If you've had few miscarriages before, and I will touch on this a little bit more later on, your risk definitely goes up. And if there is a strong family history of miscarriage. Now, because miscarriage is so common out there, there would be someone in your family with a history, and it doesn't necessarily mean that you will miscarry or that you've got a family history of some sort of underlying predisposition to miscarriage. It is so common out there. Genetic abnormality, chromosome problems like translocation, for example, is also a common cause of miscarriage. I have a patient whose mother took about 10 years before she finally conceived him, but because she started young at 20, it took her till the age of 30 before she finally conceived. That problem, genetic problem that she has, is then passed on to his son, who is now trying to have a baby, and now is having a hard time. So it's certainly it's one of the common causes of recurrent miscarriage. Less easily quantifiable factors like lifestyle, caffeine, alcohol, cigarettes. I don't know whether they are necessarily factors in causing recurrent miscarriage, but certainly they are factors associated with miscarriage. Obesity. Now, in this modern era, caloric surplus or an excess of calories in our diet is a common thing. Food is so readily available and cheap, relatively cheap now, and we are becoming bigger and bigger people, and certainly obesity is also a risk factor associated with miscarriage. Let's look a little bit closer into previous miscarriage history. If you've had 2 previous miscarriages, your risk of another 3rd miscarriage is really not that much higher. However, if you've had 3 miscarriages, then your risk of a further miscarriage really goes up to close to 50%. And most miscarriages actually occur before the 12th week mark. What are some of the signs and symptoms of a miscarriage? The most common one, of course, is vaginal bleeding, and with or without the passage of clots. Lower abdominal cramps, obviously common. Sometimes a miscarriage can be picked up early on an ultrasound scan, because ultrasound scans are now done very commonly in most clinics, and sometimes the detection of a pregnancy without a fetal heart is a common way of diagnosing miscarriage now. So the causes of miscarriage are many and varied. There is a whole list of them which I will go into. Some of them are proven, yet many others are unproven. And unfortunately, only about 50% have an identifiable cause. So chromosome abnormality in the parents, if there is a 4% of couples with recurrent miscarriage versus 0.2% of couples of the normal population would have a chromosomal abnormality. So having couples with recurrent miscarriage, you're about several times increased risk there of having a chromosome abnormality. And the most common one is what we call translocations, and there are two different types. You don't really need to know about this. And also more subtle deletions or absence of important messages in the chromosomes or of the cell. Uterine abnormality. Uterus is the womb, so abnormality of the womb can certainly cause recurrent miscarriage. The most common one is what they call a septate uterus. Now basically what that means is the uterus has got a little partition in the middle, so having that partition in the middle kind of decreases the size of the uterine cavity, and that can predispose to recurrent miscarriage. There is an abnormality called a single horn uterus or a unicornuate uterus. That can also, it's the same principle, it restricts the size of the cavity, causes all sorts of problems relating to blood flow abnormality, lining abnormality, and all sorts of issues. Asherman syndrome is basically all you need to know is that it's due to a type of scarring involving the lining of the womb, which you commonly see after women with lots of curettes, for say termination of pregnancies or abortions or infections. Fibroids is also a possible cause. It depends on the types, where it is, and it certainly can cause recurrent miscarriage. Just a quick demonstration here of the different types of uterine or womb abnormality. The septate one that I mentioned before is basically that here they've got this little partition. When the womb is formed in the fetus, it's actually formed from two tubes that fuse together in the midline, and any number of fusion abnormality can result in all sorts of weird changes and abnormality in the womb. Just a quick picture, a picture here of a uterus with multiple fibroids. There are different types of fibroids. You've got the ones that are probably important are what we call the pedunculated, or the ones that just happen underneath the lining of the womb. That can certainly impact on fertility. And also the ones that are in the muscle wall, if they are of sufficient size, they can certainly affect the pregnancy. Blood problems. There are certain types of blood conditions that can jeopardize a pregnancy. The most common one is antiphospholipid syndrome, and there are other ones called the thrombophilias, which are generally passed on, and also a condition called thrombocytopenia. Thrombocythemia, I meant. These are conditions that cause thickening in the blood and reduce blood flow, thereby compromising the developing embryo in its early stage in the womb. Hormone problems. Now these are getting to less proven territory, where there is a theory there that if you have high levels of LH, that may cause problems with the eggs, and then causing problem with the quality of the embryos, and excess in male hormones or another hormone called prolactin. Now the results are conflicting, and basically there's not a lot to really say other than that it's probably not proven, and it's probably more complicated than we think. An immune system problem, and these are not proven either. Basically the body producing antibodies, which are little proteins that start attacking the implanting embryo, and resulting in a failure in the pregnancy. And then there is this group of cells called the natural killer cells, which is a type of white cells. They're naturally there in the womb during implantation, but some kind of abnormality in the way the cells react, perhaps, that may cause the failure in the pregnancy. Now, these are very difficult to prove. So cervical weakness, now this is not an uncommon problem. If a woman's had surgery to the cervix, in particular the type of surgery that requires to take, a substantial chunk of the cervix, like a procedure called cone biopsy, for example, and that's often done for women with abnormality of the cervix. That can certainly result in weakness in the cervix and its ability to hang on to the pregnancy. Infections may cause what we call sporadic miscarriage, or may cause 1 or 2 miscarriages, but certainly it is unlikely that multiple, lots of infections causing lots of repeat miscarriages. It's probably not a common cause of recurrent miscarriage, but may be involved with 1 or 2 miscarriages.
I'm sorry.
And I mentioned about coffee and smoking before. There's a condition that results in a high level of a blood compound called homocysteine, and that's result from a gene mutation in the metrotetrahydrofolate reductase gene in the chromosome that can result in high levels of this product, which can result in thickening of the blood and problems with blood flow and failure of pregnancy. Stress, it's difficult to prove that, I don't think acute stress is the cause. Chronic stress perhaps, but it's certainly very difficult to prove. Certainly to prove the cause of recurrent miscarriage. And there are a couple of other things I've listed here that are probably not that important. So how do you treat recurrent miscarriage? The treatment would depend on the cause. If it's a problem to do with the chromosomes, genetic counseling, so seeing a counselor that's well versed with the conditions at hand. If it's something that cannot be treated, then you can actually obtain eggs or sperm from a donor that's normal, or you can actually go through IVF and have the embryos tested for the chromosome problem and then put in the embryo that doesn't have the problem. If it's an abnormality of the uterus, the septum can be removed. If it's a fibroid, that can also be removed. Blood problems, conditions that causes thickening in the bloods can be treated with aspirin or heparin. Heparin is a blood thinning agent. It's given as an injection, usually daily, to help thin the blood and promote blood flow and improve the chances of the pregnancy surviving and developing into a normal baby. Weakness in the cervix can certainly be treated with a stitch. It is known as a cervical cerclage. A stitch is put around the cervix to basically keep it shut, and the knots are tied at the front. So when the pregnancy reaches about 36 weeks, the cervix, the stitch can be removed, and generally speaking, the patient goes into labor shortly after. Hormone problems as a cause of recurrent miscarriage. It may work for some women. Doctors may put them on progesterone to help support the lining, and that may help for some patients. Immune system problems, the treatment are not proven, and I don't think I'll go much into that. If you've got this condition with the mutation in the hormone, in the gene MTHFR, the doctor can actually check for the gene mutation and also check for the homocysteine levels in the blood. If that's elevated, then the doctor can check what a compound called folic acid and vitamin B12 in the blood, and if the folic acid levels are normal or even abnormally high, abnormally low, then the doctor can put you on folic acid to try to normalize it, and that would help to bring down these homocysteine levels and decrease the risk of clotting. However, if the folic acid doesn't fall, if the homocysteine levels don't fall with folic acid supplementation, then the doctor can often add vitamin B6 and B12 as well. So basically there are treatments the doctors can do. So to conclude, this topic of recurrent miscarriage, as you can see, is rather complex. The doctor may not always have an answer. Not all treatments are always effective. However, there are treatments out there that are effective depending on the cause. If you've had 3 miscarriages, or if you've had 2 miscarriages and you're over the age of 38, I think you need to see a doctor. So just the last slide here, help is at hand. I think it's important that you see a doctor, a gynecologist, preferably one who is very experienced in dealing with recurrent miscarriage, and help you work through the problem. So lastly, I'd just like to thank everyone here for attending, and I would like to take questions if there are questions from the forum.
Thank you very much, Doc. That was indeed very informative. All right. I'd like to inform everyone that we're now in the question and answer session. So for those who haven't typed in their questions yet, don't miss this chance to get your questions answered. Now, Doc, let me start with the first question here. This is from a woman who is 7 weeks pregnant, and she said, how will my Graves' disease affect my pregnancy?
Graves' disease. Okay, now, are you in the overactive or underactive part of the disease? Most women with Graves' disease, they're hypothyroid, so they actually have problems with the antibodies producing or mimicking another hormone, so they're actually quite overactive in their thyroid levels. So the overactivity in the thyroid hormones can jeopardize your pregnancy in a number of ways. Thyroid hormone is a very pervasive hormone. It affects all sorts of body systems in your body. So if you've got Graves' disease that are not well controlled, you should certainly see someone and bring that thyroid hormone levels well under control. Otherwise, your pregnancy can be jeopardized and, worse still, result in a miscarriage.
Our next question here. The attendee said, I had 2 miscarriages. I've been told that my first miscarriage was due to a genetic problem, and that the second one was caused by getting pregnant too soon after my first miscarriage. Is the second reason possible?
Probably unlikely. I guess the answer to that question for your first scenario is how and whether it was proven that the cause of the first miscarriage was due to a genetic problem, and what kind of tests were done to verify that, firstly. Then, is this abnormality what we call a spontaneous abnormality, or is it something that is that can be passed on, like a translocation type problem? However, that would be my answer to the first part. The second part, when you say it's too soon, what are we talking about here? Months or years? Or I don't think, it's hard to know, but I really don't think that that's a plausible explanation for the cause of the second miscarriage.
We also have another question here from a woman who apparently had miscarriages. Okay, her question is, I had 2 consecutive miscarriages. Both were in 9 to 10 weeks. My last miscarriage was in April 21, 2010. When is the best time to be pregnant again? Is it because of the genetic problem, or is it because of blood thickening? I had several tests, but with different results. However, most of them are in normal range.
Firstly, I guess what would be important to know is the age of this person. Having had 2 miscarriages are really not that uncommon, and her risk of the next miscarriage is probably not much higher, having had 2. If I don't know anything more about her, I would have to say that the most likely cause of her miscarriage is to do with a spontaneous chromosome abnormality. And what I mean by that is it's probably due to problems with either the egg or the sperm coming together, causing problems with the new set of chromosomes. And one of the most common causes here, are conditions like Turner syndrome, Down syndrome. These are all spontaneous abnormalities. Happens when the egg and the sperm unite. They don't tend to be a genetic condition that gets passed on. This chromosome type abnormality or spontaneous chromosome abnormality is related to age. So the older the patient is, the higher the risk of that happening.
Just like to add that she said she's 37 years old.
Right. Okay. So she is, I would say, at an age where her risk of miscarriages will naturally go up. So I would say that her risk is probably to do with a spontaneous chromosome problem, not knowing much more about her, and obviously not knowing much more about the test that she had, and any other factors about her, whether she's had a normal uterus. I would say if she walked off the street and she gave me those information and I were to have a guess, I would say most likely it's to do with some sort of spontaneous chromosome problems.
Okay. Thank you very much. I hope that answered the attendee's question. Moving on to our next question here. An attendee would like to know what a missed miscarriage is.
Okay. A miscarriage basically is a failure in the pregnancy developing. There are many reasons for the cause of a miscarriage. A miscarriage is generally adopted as a failure of pregnancy to get to about 20 or 24 weeks, depending on which definition you use. Basically, most miscarriages, if you look at them, most pregnancies fail if they were to have a miscarriage before about 8 to 10 weeks. So a miscarriage, generally used by lay people, is a failure of pregnancy. But in the medical fraternity, miscarriage or missed abortion is another term that we use quite commonly to substitute the word for miscarriage. Basically, it's a failure of pregnancy to attain viability with the age cutoff at about 20 to 24 weeks.
Okay. Another one here is there any relation between a person's diet and the occurrence of miscarriage?
Yes, there is some association. I mentioned that in the talk, but it's very difficult to prove, really. People talk about, if you look at studies that were done, trying to link causes of dietary factors to miscarriage, the common things that come up are, smoking, or it's not a diet, but coffee, for example, high amounts of alcohol consumption would be another one. Definitely, I'm sure that has a bearing, but what I'm talking about is whether poor diet has a bearing on recurrent miscarriage. It's probably less likely, but certainly in some cases, it could result in a miscarriage. Women that consume binge alcohol, for example, after a party without knowing that they're pregnant and subsequently found that they're pregnant, some of these women miscarry as well. So definitely higher risk in those patients.
Okay. Another one here, another question is, I've had 3 miscarriages over a period of 14 years and never had a live birth. Additionally, the pregnancies were with a different person each time. Does this mean that the problem likely rests with me?
And again, I would like to know the age of this person, and I need a little bit more information. How long has she been trying with each pregnancy? At what stage they miscarry? Whether there were tests done on them, on the conceptus or the abortus? It's possible that the problem may lie with her, and again, it may not be, because each time she falls pregnant, when she's with the new partner, a first partner, she may just be unlucky, and the second time round she's a fair bit older and the risk of miscarriage goes up anyway, and then again with the third miscarriage, it could just be because she's also older. So it's difficult to know whether that's the case. Sperm abnormality, there's been linked to to cause a miscarriage. So the answer to that question is it may be, but I think it needs to be looked at further.
Right. Okay, Doc, and this must be your last question for this afternoon. Okay, second to the last question. Does having too much physical activity will it affect my pregnancy?
Right, so I'm assuming that this woman is currently pregnant. And physical activities, you know, it's very difficult to quantify pregnancy. When you talk about strenuous activities, are you talking about, you know, the person, you know, climbing Mount Everest, or, you know, are you talking about a person who, you know, normally goes for a run before her pregnancy and still enjoys that during her early parts of the pregnancy? The question to that is, if you are not used to doing strenuous activity and you put yourself through that, very strenuous, like, you know, climbing Mount Everest, possibly that would be bad for your pregnancy on many different fronts. But if you're someone who's normally fit and, you know, goes for a run or a swim normally, even when you're not pregnant, it's nothing wrong with enjoying a bit of physical, you know, exercise even when you're pregnant, within moderation. One of the things I would say to my patients when they're pregnant is, if you want to exercise, a general guide would be, if you are, say, on the treadmill, you know, I wouldn't go for a full run. I'd go for a stroll. If you best things to do exercise when you're pregnant would be on a bicycle, an exercise bike, for example, where it's low impact, and you should work your heart rate to a point where actually you shouldn't really be using your heart rate as a guidance. You should use your breathing. I mean, if you work to a point where you start to feel a bit short of breath, but you're still able to talk in full sentences, I think that would be enough. I don't think you need to go any further. And it's important, when you say physical activities, I mean exercise, that you that you don't overheat, you maintain well hydrated, and you wear loose clothing, and you make sure you're, you know, doing your physical activities in a well, you know, ventilated room. It's important that you don't stay sedentary in pregnancy. It doesn't mean you have to sort of, you know, don't do anything at all. I think that's not good. I think to stay active, to move around, to enjoy your pregnancy and feel positive about yourself is probably the best way to approach your pregnancy.
Okay, thank you very much, Doc. In addition to that, is it really true that swimming is not safe for pregnant women?
Not true. In fact, swimming is often one of the best form of exercise in pregnancy. The buoyancy of the water, it's important. It helps to soothe your joint. Here in Australia, we have exercise classes, water-based exercise classes or aerobics. Women enjoy it, particularly in the cooler months, exercising in the water, jumping around with the, you know, comfort of the buoyancy, cushioning your impact, going for a nice gentle swim. I think that's all good.
All right.
So swimming is actually a good thing. I mean, there would be situations where you wouldn't want to be swimming. For example, if you're leaking fluid, if there is any problems with your pregnancy, you would always need to obviously get clearance from your doctor. And I'm assuming that, all the pregnancy is going well. Then I don't think, I think swimming is a good physical outlet.
Okay. And our last question here is from a 24-year-old, and she said, I've been trying to get pregnant this month. My period was 4 days late. It was lighter than usual with cramping that is worse than I'm used to. My periods are usually regular. I had miscarriage 3 months ago. Could this be another one?
Possible. It could be an early implantation failure, or it could just be a bad period. Sometimes your periods could be a little bit abnormal or a little bit different after a miscarriage. 4 days late, it's really not here or there. I mean, it is possible. It is possible. But if you were to look at your age alone, 24, I mean, you would be in a very good position to fall pregnant again, and good chance of the pregnancy going to full term. So I won't be too concerned at this stage, except to continue to monitor your periods and make sure you have regular time intercourse. But we're getting into another area here, which is fertility. So, which I guess would be a topic of discussion on another day. But I would say that it's possible, but I would be very optimistic in your case.
Oh, Doc, with just one last question, if you don't mind.
Not at all.
Okay, and the question is, does having abortion early in life, say for example in teenage years, predispose someone to miscarriages later in life?
I would take it that when you meant abortion, that you meant surgical abortion or surgical termination of pregnancy, so electively terminating a pregnancy. No, I mean, I guess if it's done properly in a stringent aseptic condition where there is no increased risk of infection to the womb, then and afterwards you have regular periods and no problems there, I don't think so. But I am referring to, in my talk, I'm referring to women that have a condition called Asherman. So these are women who have repeated miscarriages from someone who's had lots of curettes or abortions in the past, that has basically scarred or damaged the lining. In that situation, yes. But if you've had one or two and done properly and have had no issues afterwards, probably unlikely.
Okay. Thank you very much, Doc. That ends our question and answer session.
It's a pleasure.
Okay.
Good night, everyone.